Hi to everyone, Physio Megan here. So today I want to talk to you a little bit about knee pain and running with knee pain. Now, knee pain is very common in runners. We can often get a condition called patellofemoral pain, very common in women in comparison to men. And we usually treat it looking at things like hip strengthening exercises and gait retraining. But the thing about patellofemoral pain is often we can still run with it. And the question is, should we be running with it or should we be rehabbing and resting to a degree? Now, I want to talk to you a little bit about tissue sensitivity and how studies have shown that when runners have patellofemoral pain and they continue to run, what it actually does is it reduces the function of the knee. Runners often have poorer outcome measures for their knee function, and they have increased sensitivity of that knee as well. Now, we need to be really mindful of this because it isn't always just a case of we increase sensitivity, we rest for a few days, everything settles down, and then we can run again. We have to be mindful because the body can sometimes do something what we call central sensitization, where there's actual changes or structural changes within the brain, and that influences how our body perceives pain. So we have receptors in the knee, and these are called nociceptors, and their job is to detect just changes. So they're not pain receptors, they might check for pressure changes, chemical changes, temperature changes, send a signal to the brain, and then it's the brain's job to work out whether these are potentially harmful and whether it should be warning us, and that's normally by producing a pain signal. Now, if we continue to run with pain, we get sensitivity within the tissues. And what it means is that when these receptors detect things that are going on in the knee, the threshold in the brain is lower. So you require less of a stimulus for basically the pain to give you, for the brain to give you a pain output. Now, if you notice you're running and it's almost like the less you do, the more you're getting pain, that could be a sign of increase in tissue sensitivity. Now, central sensitization that I talked about can include increased tissue sensitivity, but also it can lead to the brain detecting non-noxious stimulus as painful or as potentially dangerous, so therefore it's causing pain. So this can be things like if you stroke the outside of your knee, if it feels really sensitive to touch. Now, stroking isn't normally a noxious stimulus, the pressure isn't high enough, and therefore it would be considered that you're getting this response to non-noxious stimulus. And that would show me as a physio that there is potentially some central sensitization going on, that potentially the brain isn't recognizing the signals in the way that we want it to, and that we're getting this hypersensitivity and this increased response to changes within the knee. And that could be touch, it could be pressure changes within the knee joint as well. So it's generally discouraged to keep sort of plowing through and running through pain because we don't want these central changes to occur. We don't want these brain changes to occur where we are then experiencing more pain or pain to non-noxious stimulus. And it's a bit confusing, and it's all a little bit sort of can be a little bit strange, especially when you can feel the knee pain and you feel it coming on at certain times. But it's generally discouraged to increase that running volume whilst you're getting knee pain. One thing that can be really, really good to do is get your knee assessed, understand why that pain might be occurring. Look at load management in terms of your running volume. You don't always need lots of additional exercises and loads more things to do. That's sometimes not very helpful at all. You might not need gait retraining, you might need gait retraining. It kind of all depends on the individual because the way our brain perceives things, again, is very, very individual. So just something a little bit more off the cuff that's not just an acute injury that might be worth considering if you have pain, especially around that knee, and you're continuing to run through it. Won't be fearful of it, don't be scared, but just get that assessment, find out what's going on, and then hopefully you might even be able to run pain-free in the long term. I hope you found that helpful, guys. If you've got any questions, please bob a comment below and I will do my best to answer. Other than that, happy running.